How to prepare referral letters and specialist reports for medical virtual assistants. Hi everyone, welcome back to our channel where we provide continuing education for medical coders, billers, and virtual assistants. I am your host. Today we're going to discuss how to prepare referral letters and specialist reports for medical virtual assistants. Referral letters are used to seek the expertise of another physician in the diagnosis or treatment of a patient's illness or injury. It is typically written by a primary care provider, but can also be written by specialists. The letter provides the referring provider's perspective about the patient and their condition, and serves as a request for specific assistance from the specialist. Now, before we dive into the anatomy of a referral letter, let's first define a few terms. I want to make sure we're all on the same page. PCP stands for primary care provider. It's usually your family doctor or internal medicine doctor. A specialist is a healthcare provider with advanced training and certification in a particular area of medicine, such as cardiology, oncology, neurology, orthopedics, gastroenterology, and the list goes on. An HHA is a home health agency. They provide skilled nursing care and other services to patients in their homes. A POC is a plan of care. That's usually a document used in home health, where the plan of care is developed collaboratively between the patient, the family, and the home health agency. And lastly, a physician order is a directive written by a physician that tells you what treatments or services are going to be provided to a patient. Okay, now that we have those definitions out of the way, let's look at the anatomy of a referral letter. Referral letters are typically formatted as a letter with the following components: date, inside address, greeting, body of the letter, closing, signature, and provider information. Now let's take a deeper look into each section. The referral letter date should be placed above the inside address, and it should reflect the date the referral letter was written. The inside address would include the name, title, and address of the recipient, which is usually the specialist you're referring the patient to. Next, you would add the greeting. This is usually a standard business letter greeting like "Dear" or "To whom it may concern," followed by the appropriate title and last name of the recipient. Next is the body of the letter. This is the main part of the referral letter, and it typically includes 5 important components. First, you want to state the purpose of the referral. In this section, you would explain why you are referring the patient to the specialist and include any relevant details about the patient's condition or symptoms. Next, you want to provide a brief history of the patient's illness or injury, including the onset of symptoms, any previous treatments that have been tried, and any relevant medical history. You also want to include a physical examination summary of your findings. If there are any, don't forget to include any diagnostic test results that support your reason for referral. Lastly, state your differential diagnosis so the specialist has an idea of what conditions you're considering. The next component of a referral letter is the closing. This is typically a standard closing like "sincerely" or "respectfully," followed by the signature of the referring provider. Below the signature, you would include the full name and credentials of the referring provider and their contact information, including their address, phone number, and NPI. Now that we understand the anatomy of a referral letter, let's take a look at an example. Here is a sample referral letter for a 68-year-old male patient presenting to his primary care physician with complaints of chest pain. As you review the letter, keep in mind the components we just discussed. Let's shift our attention to specialist reports. Unlike referral letters, which are written by PCPs or other referring providers, specialist reports are written by the specialist after they have examined the patient. These reports serve several purposes. They provide documentation of the patient's diagnosis, treatment plan, and prognosis. They also serve as a communication tool for the specialist to share their findings with other members of the healthcare team, including the referring provider. Now let's take a look at the anatomy of a specialist report. Specialist reports typically follow a standard structure with the following components: patient demographics, date of service, referring provider, admitting or consulting service, diagnosis, history, physical examination, assessment, and plan. Let's take a closer look at each component. Patient demographics include the patient's name, date of birth, and medical record number. The date of service refers to the date the specialist provided care to the patient. The referring provider is the provider who referred the patient to the specialist. The admitting or consulting service indicates whether the specialist is the admitting provider meaning they are responsible for the overall management of the patient's care, or a consulting provider who is providing expertise on a specific aspect of the patient's illness or injury. The diagnosis section includes both the principal or primary diagnosis and any secondary or additional diagnoses. The history section includes the patient's chief complaint, history of present illness, past medical history, social history, and family history. The physical examination section describes the findings from the specialist's examination of the patient. The assessment section includes the specialist's interpretation of the patient's condition based on the history and physical examination findings, including the differential diagnosis. And lastly, the plan section outlines the recommended treatment or management for the patient, including medications, procedures, and any referrals to other providers or specialists. Now that we understand the anatomy of a specialist report, let's take a look at an example. Here's a sample specialist report for a 68-year-old male patient seen by a cardiologist for chest pain. As you review the report, keep in mind the components we just discussed. Alright, that's it for today. Thank you so much for watching. I hope this video was helpful. If you have any questions, please leave them in the comment section below. Don't forget to like and subscribe.